So, gather equipment, check the medication order against the original positions, order according to agency policy, clarify any inconsistencies, check the patient chart for allergies. Note the action special nursing considerations, state dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication to this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer, enter passcode, and scan employee identification if required. Prepare the medication for one patient at a time. Read the medication administration record or the MAR, and select the proper medication from the patient's medication drawer or unit of stock. Compare the label with the MAR, check the expiration dates, and perform calculations if necessary. Scan barcode on the package if required. In preparing the required medication, we have three procedures. If the unit dose package, place unit dose package medication in a disposable cup. Do not open wrapper until at the bedside. Keep narcotics and medication that require special nursing assessment in a separate container. The second is the multi-dose containers. When removing tablets or capsules from a multi-dose bottle, pour the necessary number into the bottle cup and then place the table in a medication cup. Break only scored tablets if necessary to obtain the proper dosage. Do not touch tablets with your hands. And the third is the liquid medication in multi-dose bottle. When pouring liquid medication in a multi-dose bottle, hold the bottle so the label is against the palm. Use the appropriate measuring device when pouring liquids. And read the amount of medication at the bottom of the meniscus at eye level. Wipe the lip of the bottle with a paper towel. When all medications for one patient have been prepared, recheck the label with the MAR before taking them to the patient. And replace any multi-dose containers in the patient's container or unit stock, or lock the medication cart before leaving it. Transport the medication to the patient's bedside. Carefully and keep the medication in sight at all times. Ensure that the patients receive the medication at the correct time. Identify the patient using the three methods and compare information with the MAR. Check the name and identification number or on the patient's identification band. And the second is ask the patient to state his or her name. And the third, if the patient cannot identify him or herself, verify the patient identification with the staff member who knows the patients for the second sources, or the SO, the significant others. Complete necessary assessment before administering medication. Explain the purpose and action of each medication to the patient. Sir, I will give you the paracetamol biogesic for your headache. Assist the patient to an upright or lateral position. Sir, bangon po kayo. Inom po kayo ng medication. Administer medication. Offer a water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Sir, ask whether the patient prefers to take the medication by hand or in a cup. Sir, inom muna po kayo, sir. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Sir? and perform hand hygiene. And leave the patient in a comfortable position. Check on the patients within 30 minutes or time appropriate for the drugs to verify response to medication. And then document the findings to the patient charts.